Thank you very much for the opportunity. Some slides. That was our situation in 1970, a very bad one, as you can see, except for measles. All the coverages were very low. We had, during these years, very, very important effort, and we get good results. If you see at the end of the 2010, we have almost all vaccines with a coverage rate over 95%, except for rotavirus and pneumococcal vaccines. But it's a huge progress that we have, and controlling most of the disease preventable by vaccines. But recently we had some backdrops, especially for children under 5. The first line, you see the red numbers are where besides the coverage, the desired coverage, even for health workers, trabalhadores de saúde means health workers, but also for pregnant women. The three groups, children under 5, health workers, and pregnant women, has reduced the coverage. What explains this coverage? It's clear that there is no single cause. There are several. Maybe people do not want to be vaccinated because they do not see any more risks. The diseases are very reduced in incidence. Maybe there is some anti-vaccines campaign. People are afraid of being collateral effects of adverse effects of vaccinations, but also maybe there are been problems of inefficiency in the provision of vaccines. Shortage. We have our own production, national production of most of the vaccines, but not only for the newest ones. And the program is to be very efficient in the sense that we get and have enough money to have all the vaccines bought at a very low price. And the new vaccines are very much more expensive, so it's difficult to have it. But also the expansion of the systems may have had some lack of trained people. And our units, health establishments, they maybe have they work during the day, but not in the night, maybe it's in the evening, maybe it's a problem also. And sometimes with the move from the paper record to the electronic record of data, we could have missed some recording of this process. There is now initiatives trying to recover the coverage, the rates of coverage, by doing many public campaigns through the media, and also to invest in the new good practice of manufacturing by our own manufacturers in Brazil. So that's it. Thank you.
Thank you.